Hi guys, Jake Klein here, pediatric nurse practitioner at OKC Kids Urology in Oklahoma City. We're going to do a little quick educational video on urinary tract infection, and we're going to be specific. Let's say that you have a diagnosis of bladder exstrophy and you catheterize. You're doing a clean intermittent catheterization program and you're trying to determine, do I have a urinary tract infection or not? What would be your potential symptoms? Well, you can get fever. That's going to be one symptom. You can get foul smelling urine. You can get very cloudy urine. You can have increased urgency or frequency, feeling like you need to cath more often. You can have urinary leakage. These are all going to be different signs and symptoms that a typical bladder exstrophy patient that is on catheterization would experience. And if that was to happen, how do you sort that out? So take, for example, that you had a fever and it got up to 102, and you also noticed that your urine was a little cloudy. You haven't been feeling real great. You think you may have the flu or a virus, haven't been drinking very well. When we're not hydrating well, we almost invariably get dehydrated and get a urinary tract infection. And so let's say you proceed to your pediatrician and, well, they do a viral panel. And it comes up negative. You don't have COVID, you don't have the flu, but you still have fever and things just are not right with your bladder. Well, obviously, if you're colonized, as all people on CIC are, because the bacteria will normally live in the bladder, well, what are some things that you can do to get yourself out of trouble if you have a UTI? So again, if you're catheterizing the bladder, always take your time to get completely empty so that when you're finished, your residual is zero. Because if you pull the catheter out too quick and you leave some urine behind, it's dark, it is warm, it is moist. Remember that our rectums are right beside our bladder and they're full of E. coli. This is the #1 culprit for urinary tract infections in over 90%. And so if you have a dark, warm, moist environment and you're on CIC, well, you're already colonized, okay? And so we know that that bladder is always going to show us infection. That's what makes working up these viruses and actual UTIs more difficult, is because pediatricians know, well, they're always going to test positive on their urine. If I can't find a source, well, we can treat that. But just remember, you can always work on emptying better, and you can always work on decreasing these elements, because bacteria like darkness, warmth, and moisture. And the fourth thing that they like is time, extended periods of time. And so if you're cathing every 6 hours and you're having a lot of trouble with recurrent UTIs, start cathing at every 4 hours. Do a little bit more bladder irrigation, squeeze those times together, and you'll be able to decrease your colonization and have less symptoms. If you irrigate and you don't get better, you've irrigated with each cath for 2 to 3 days and you're still not feeling well, well, then you need a urine culture. Okay, and the urine culture is going to tell you what's growing in the urine and what antibiotic is going to eradicate that bacteria. And that's what I call shocking the pool. Sometimes you're going to have a symptomatic UTI once or twice a year, and you're going to need some antibiotics, and it'll clear things up. Things are going to smell better and look better. But if you get on a good schedule of cathing and irrigating, you should be able to maintain that with minimal symptoms. So again, my name is Jake Klein, pediatric nurse practitioner with OKC Kids Urology here in Oklahoma City. Thanks for tuning in on this little UTI talk specific for exstrophy kids that are catheterizing. If you have any more questions, give us a call. We're glad to work with you. Thanks.